All right, good afternoon. So as some of you saw, we attempted to do all the probate law in one event here, and that was probably too much, and we had technical issues on both sides. So we're going to do it in three more easily digestible sections here. So I will share my screen, and I'm going to have you bear with me on the first thing, which is going to be in a second here, we'll do a video, which last time did not sound well, and I think we've got it solved now. So I was taught how to embed the video. So we're going to see if that works for everybody. So this, just as a quick intro, so many of you weren't here before. So the pink slip remains confusing and used differently and sometimes misused statewide. And I know that because the main attorney at OWACBA, which is the big organization for all of the boards, like the ADM board, there are 50 of us. She and I did a talk, 2 years ago, probably now, expecting 60 or 100 people to participate, and we had over 1,200 people log on to watch us talk about this, and we got, I don't exaggerate at all, 250 questions in the chat that we then spent 2 hours jointly answering while others were talking about different topics. So it is a very challenging topic, and yet at one level, relatively simplistic. So I'm going to walk through the pink slip today, kind of up to the point of the pink slip, and then we'll do more of this. I think the next one is March 1st. Does that sound right, Nicole? I think so. Anyway, we'll do more coming up in three bites to hopefully make this more digestible. So Judge Stormer is phenomenal. She was on our criminal court in the common pleas for many, many years and has now been our head of the probate court for at least the 12 years I've been at the ADM board here in Summit County. So she's excellent. She is truly a leader in probate court type issues, now sitting on the national board for the Treatment Advocacy Center, where Betsy Johnson is at. Betsy was with NAMI Ohio for years. And again, full disclosure, I'm on the NAMI Ohio Board of Trustees even now. And so she then joined the Treatment Advocacy Center as the regional coordinator for them. And then I already mentioned her, Christina Shanak Diaz, an attorney, and she had been in private practice. She then happily, for all of us, joined OWACBA, which is the organization for all the 50 boards. Some are called ADA MHS, some are called Mental Health and Recovery Service Boards, like Stark is Stark MAR, Mental Health and Recovery, and some are as simple as us, ADM. We went with the simple approach here in Summit County. So I want to show you this video. I did already do the sound. Hopefully this works this time. It just sets the stage, I think, better than me talking about it. And then it's only 6 minutes. And then I will continue with the more in the weeds on the pink slip here.
There are a few things that creep Americans out as much as asylums. And when you know the history, you begin to understand why. Conditions in these institutions could be horrifying. One famous facility in West Virginia housed nearly 10 times more patients than it was built to hold. It was so short on space that it kept many of the patients in cages. Data from the 1950s shows that 2/3 of the psychiatric patients treated in mental institutions underwent either electroshock therapy, comas intentionally brought on by insulin overdoses, or lobotomies. It was terrible. So, beginning in the 1960s, we shut them down. Just one problem. When we got rid of the asylums, we replaced them with a system that may be even worse. Why did America suddenly decide to reject mental institutions in the middle of the 20th century? Part of the explanation was journalistic exposés that brought the conditions within them to the attention of the public. But there was also another factor at work. We thought we didn't need them anymore. The development of the first generation of antipsychotic drugs convinced many Americans that the mentally ill no longer needed to be in institutions, that they could be sent home and treated in their communities. It was a deeply humanitarian impulse, and it went horribly, horribly wrong. There are over 51 million Americans who suffer from some form of mental illness. The vast majority of those, however, have ailments that are perfectly manageable with proper care. Many of them have conditions so subtle, you'd never know they're sick. The real difficulty lies with a much smaller group, the 8.3 million Americans suffering from severe mental illness. What's the difference? Severe mental illness refers to afflictions such as schizophrenia, severe bipolar disorders, or the most catastrophic forms of depression. Ailments that, when left untreated, leave people unable to take care of themselves. And a lot of them are going untreated, somewhere between 40 and 50%. Why so many? Part of the reason is that many of them suffer from a condition called anosognosia. It's a fancy word with a simple meaning. They don't actually realize they're sick. As the mental health advocate DJ Jaffe wrote, when people with mental illness walk down the street screaming, "I am the Messiah," it's not because they believe they're the Messiah. They know it. They are totally unaware they are ill. If individuals in such dire circumstances don't know they're sick, how can they be expected to be responsible for getting the treatment they require? The obvious solution would be to entrust their care to loved ones. But medical privacy laws prevent doctors from disclosing to family members both the diagnosis of a severe mental illness and any medications that have been prescribed. The only people who can help are kept almost completely in the dark. The result, the severely mentally ill are no longer suffering in asylums. They're just suffering everywhere else. While they make up only about 5% of the country's population, they're about 30% of America's homeless population. And many who aren't on the streets are behind bars. In 44 states, a jail or prison holds more mentally ill individuals than the largest state psychiatric hospital. In fact, any honest accounting of the numbers would show that the 3 largest mental institutions in America are the Los Angeles County Jail, the Cook County Jail in Chicago, and the jail at Rikers Island in New York City. Real compassion would involve policies that aim to help the mentally ill, not to leave them alone and tortured by their illness. Thankfully, we know what some of those policies are. Programs like assisted outpatient treatment, or AOT, which allows courts to compel treatment in the community for people who otherwise won't get help. AOT programs can be transformative. Amongst those who participated in New York, their rates of homelessness went down 74%. Their rates of incarceration went down 87%. But too often these programs are short on resources or underutilized, meaning they help far fewer people than they could. And they're only part of the puzzle. Policymakers will have to change laws to empower family members to adequately care for their loved ones. And for the sickest individuals, we may even need dedicated facilities to play the role asylums were once supposed to. After all, if hospitals were as dangerous and dysfunctional as the mental institutions used to be, would we have just gotten rid of all of them? Or would we have built better ones? When we look back at the rotting asylums of an earlier generation, we find it hard to believe we ever treated the severely mentally ill with so little compassion. But if, in the present day, we continue to relegate the mentally ill to prison or the streets rather than getting them the help they deserve, will future generations judge us any less harshly?
All right. So I hope that sets the stage a bit, and that part of the purpose of the pink slip is to give first responders another alternative to get people into treatment as opposed to in taking them to jail, which happens still too much, even in places with good use of pink slips, and then ultimately use of assisted outpatient treatment, which will be in the third lecture that I give on the series here. So we're going to go from the beginning, but all the way through to the likely positive end of that process. And I'll just say here, I'll probably say it again then, So Judge Stormer, with her work and a lot of our team here in Summit County, we have been told, not by ourselves, that we are the best at AOT in the entire country. Summit County, they just finished filming a movie here that'll be on either Netflix or PBS whenever they get done going through 100 plus hours of, of video, some of which they won't use because it was during COVID and they don't want a movie of people in masks. But so just be aware of that. I'll let you know. I'm sure we'll share that widely once that comes out. Officially, it's by the same group that did the movie Bedlam, which is, I think, still on Netflix, actually, somewhere in the background there. So anyway, so not by my statements and not by Judge Stormer's statements or the rest of the team here. We do that very well, and that starts with the pink slip. So let me first say that it is called officially the application for emergency admission. We refer to it as the pink slip because back in the day, and including when I came to Ohio back in 1998, it was one of the hard copy forms you had to press really hard so you could make duplicates automatically. And the pink sheet is the one that followed the patient through the medical record, from an officer or clinician to an emergency department or a place like Psychiatric Emergency Services here in Summit County, and maybe then onto an inpatient unit. So that is the reason it's called the pink slip. At the same time, I am currently pushing, although I don't seem to have enough clout yet, to get the name changed on the form. It's really a misnomer, and it's confusing to our legislature, and we're trying to work on adding a new fifth criterion to that pink slip. And that's proven to be hard. And one of the reasons is that it's not an application for emergency admission. That actually what we're trying to do is get people examined. That's the word in the law. I prefer evaluation, but examination is the word in the Ohio Revised Code. We're trying to get them examined even if they don't want to be within the 24-hour window of the pink slip. And most of them are not hospitalized. So it really isn't about hospitalization. It's really about pushing people into treatment and ideally catching them before they get so severe that they need to be hospitalized. That'll be the purpose of the fifth criterion, which I'll describe in a different lecture. But just so you're aware of that, so it may get changed, but so far I haven't gotten full traction from the attorneys at OMAS, who really own this form, Department of Mental Health and Addiction Services. So this is the form. Many of you have seen this, and it really, most states have a very similar format and similar language. About half the country now, half the states have added that fifth criterion that I'll describe in a different lecture already. So we will not be groundbreaking in doing that. So therefore, I would think it would be easier to get done because it's already happened in other states. But first and foremost, you'll see here that it's for people that are mentally ill. And I say that because that gets missed sometimes when we talk to our first responders. And so if you've got Mr. Jones and Mr. Jones is threatening to kill somebody, it might be because he's a criminal, right? So you don't want to mark down number 2 here, which is basically homicidal, if actually it's because it's somebody who's not mentally ill, but is maybe even has a history of felonious assaults and the like. So the first part of this is the person's mentally ill. And then number 1 is basically suicidal. So these are imminent risk items, things you could predict would happen in effect in the next day is what we're usually talking about. So ideally, you're thinking probably right now, right? If they're at risk at the moment, they could hurt themselves any minute now. And their intention, because it gets into their mindset, obviously, is to actually either seriously harm themselves or perhaps actually die by suicide. Number 2 then is homicidal, so danger to others. So usually you hear people talk about danger to self or others. That's the kind of the phrasal here. Number 3 is a shade of gray, really, I think, of number 1. That is, they're putting themselves in harm's way, but not intentionally. And this gets into the anosognosia. This gets into they don't understand they're ill. They're really not taking care of themselves. They might accidentally leave the pot on the stove and burn their apartment down, which of course could affect many other people in the adjacent apartments. So there's a lot of reasons that number 3 gets used. And then number 4 is the broadest here because it says would benefit from treatment in a hospital, which is very important in that phrase, for mental illness and in need of treatment. And if without that treatment, basically the person creates a grave and imminent risk for number one and number two to occur, basically, for risk to others or himself. And you'll notice it's older language. It says him and himself. Obviously, he, she, they could be subject to this pink slip. This works for everybody. Another thing I'll point out, because this comes up a lot, is there is no age limit in the Ohio Revised Code, section 5122. If you can't sleep tonight, pull that up. And you can read through 5122, which has a lot of sections to it, which covers pretty much all the mental health law except for legal insanity, which is in a whole nother section, 2945 of the Revised Code. So if anybody wants to know about that, let me know, and I'll send that out as well. That's a different section. So age doesn't matter here. So if the person is 8 years old, an officer or a clinician can in fact use a pink slip to cause the person to be taken against his, her, their will, even against the parent's will, if necessary. Even if they say, no, you're not taking them. Well, yes, you called us. He had a noose around his neck. He's going in, right? So your police can definitely do that. For youth, though, they also have another thing called the Juvenile Rule 6. And basically that means that they're going to act on behalf of a parent. So kind of a parens patriae kind of language there in the law, which allows them also to take the youth against the parent's will and get them into an examination for potential treatment. So just be aware that that comes up a lot, and many law enforcement have not been trained that they can use the pink slip for youth. And so that does, but they in fact can use this for somebody under 18. Then you'll notice it says statement of belief, and this is also very important. What does that mean? Well, if you think about a law enforcement, if an officer pulls you over for speeding and they come up to the car and they ask you for your driver's license and registration, all that kind of stuff, that's all they can really do unless they see something else. You're slurring your words, right? Alcohol might be in, or something else nowadays, might be in your brain. They can ask you to step out of the car. They can only do it though if they see observable behaviors or something in the vehicle that they can observe. So obviously, a gun on the seat or marijuana historically were bigger issues. They're less now, the way the laws have changed, and everybody can carry a gun and you can smoke marijuana. But you're not supposed to smoke marijuana and drive, just like you're not supposed to drink alcohol, which has been legal forever, and drive. So the point of this is that if they have more evidence, they are allowed to go deeper and potentially even search and seizure of a house or a vehicle or what have you. The statement of belief is way low on that scale. It is a belief. It's a reasonable belief, which is the official legal terminology. And that means that any information that they receive or you as a clinician receive can be used in deciding you have a belief and then using a pink slip. So for example, the patient's grandmother calls, maybe they're the main caretaker, and says, even if the person's in their 20s, my grandson is doing X, Y, and Z. Maybe it's psychotic type behavior, maybe it's suicidal type behavior, and that's all you have. And you pink slip the grandson on that basis, and you of course document that here, that will hold up in court. The person does not have to tell you he, she, they are suicidal or who they're thinking about hurting or that kind of stuff. So if you watch too many Law and Order episodes, they call that hearsay. And yeah, there's a place where hearsay doesn't count. But for a pink slip, which of course is generally white, as you see on the screen here, because they're mostly printed off the computer now, one page, front and back, you can in fact use hearsay. So you would check at least one of these four. So you believe Mr. Jones or whoever it is mentally ill. You check at least one of these because that's your belief. You could check as many as all four. However, I've seen many that like that when they ended up at North Coast when I used to be at the state hospital. And then please, please, please write information here. Don't check number one and then write the word suicidal. That's number one, redundant. Number two, not helpful if your goal in having the person transported, usually by first responders, to an emergency department or a local pre-screening agency. In Summit County, we call that Psychiatric Emergency Services, or PES, and our nurse practitioners on here are work for Portage Path, and they are the organization that runs PES. So if the person's taken there, your goal, I'm sure, is to let them get examined, and you might be thinking they need to be hospitalized. That's often the case when a clinician or a law enforcement person does this. So you want to document stuff here that will help the clinician, the receiving clinician, to make a good judgment on that decision. So also you'll notice who can do this. So all physicians, including psychiatrists, can do this. Licensed clinical psychologists can do this. What was the only change that's been made in decades, and you can see here October of 2018 is when the last change was made. It is a Department of Mental Health and Addiction Services form, which is why I'd like them to change the name at the top here for emergency examination instead of admission. They added psychiatric nurse practitioners and psychiatric CNS professionals. So that's the only change that's been made in decades to the Ohio form. So they also now automatically are able to use the pink slip. And then parole, police, or sheriff's deputies can use this. Interestingly, when things aren't spelled out, they leave room for discussion. So right now there's a discussion going on about State Highway Patrol, which arguably they should be able to use this, but they're not officially listed here. They're not quite police, they're not quite sheriff's deputies. So that's the discussion going on. I would say, of course they can use it, but literally that's a discussion going on at the state level as we speak. The other people who can use the form are called health officers. So what is a health officer? Under 5122, the chief clinical officer of a board, so in my case, that's me at Summit County, can train individuals, generally other clinicians that aren't on this list already. So I've trained RNs and LSWs and LISWs, even depending on where they're at, because if there's no other person around, there are some settings where we really need people to be able to affect a pink slip and get somebody into care without them causing harm in that setting, in that office or that lobby or what have you. So not all boards do train anybody as a health officer, but we are able to do that. So I will train individuals somewhat what I'm telling you right now. I do a very rapid 1 hour of what we're going to break up into 3 sessions here to give a picture of what happens. How do you do a pink slip? But most important to me, what happens after you do a pink slip? Which is why we're doing 3 sections here. Because I think it's very important to know what you're actually causing to happen potentially if you do a pink slip. So again, you do the pink slip, you mark at least one of these, and then you document here. There's actually room on the back to document even more of the information on the pink slip. Then the person goes to an emergency department or again, a pre-screening type agency, and there it has to be a licensed psychologist or physician, which might be the emergency doctor, might be, if you're lucky, a psychiatrist who works in the ER. SUMA now has Dr. Heather Wobie, excellent. So she's a psychiatrist working in the ED. That's in my world, the ideal when you're doing a pink slip, because she's got all the credentials and understanding of these illnesses to work and effectively decide if somebody really needs to be hospitalized, either voluntarily or involuntarily. But so they do that. They will then fill out the back side of the sheet and document generally what their observations were, and then disposition. Either send home, which by the way is about 70% of the time the person goes back to whatever their residence is. 30% of the time the person is hospitalized. Some of that 30% is voluntary. That's ideal if you want to maintain the therapeutic alliance. Ideally, they say, you know what, you're right. I've been here for 6 hours and I understand I really need help, and they will sign a voluntary. That's awesome. But if not, and they still need to stay, and often again, it's because they lack insight, anosognosia, then that'll be the outcome, and they'll document that on the back of the sheet. So again, I've kind of mostly walked through this, but just so it's spelled out, and I did load the slide set into the iEcho platform, so you should be able to get that from the iEcho, and if you can't, Jamie can certainly send that out. So anyway, so I've walked through all of this, I think, pretty carefully, and that's the point of this, is like who can do it, what makes it legal. you can see the reason to believe here. You can see the no age limit, which I've walked through as we look at the sheet. Obviously, the emphasis that I put on here, the highlighting and the underlining, is all my doing for teaching purposes. So that's all very important. This piece has gotten controversial at times. May take the person into custody and immediately transport. So in general, of course, we as clinicians are not putting them in our vehicle and transporting, because if they're at this level of crisis, they need a first responder, an ambulance or a law enforcement vehicle to transport. But because transportation has become a problem statewide, including in Summit County, you'll get pushback. No, I don't think they need to be pink slipped, but if you think so, go ahead and do it. Well, that's great, except you don't have a way to get them to the examination. So that is, just so you're aware, that has come up. Not often, but it does come up. And I really think it's a systems problem. It's not so much that the paramedics or police don't want to do this. It's more that they don't have the time to do this. And that can cause to put somebody into further harm's way. You might have a situation where you've done the pink slip in your office. Let's say I'll use Portage Path. You're at Portage Path. They have several locations, and you're waiting for transport. And that has sadly taken an entire day at times to get first responders to transport. So now you're dealing with this person in your lobby probably for all these hours, when we're probably talking 2 miles, literally, in Akron to get the person to either of the emergency departments. So some of these things we're trying to work out here, but I mentioned that because you may be experiencing this in other parts of the state as well. So here's the Ohio Juvenile Rule 6 that I mentioned, just to codify that a little bit, literally and figuratively here. So this is another way that law enforcement can affect this. And you can, if you were to call out law enforcement on a youth, as opposed to doing a pink slip, although I would say do it. When in doubt, fill it out. But if you're for some reason not sure about that, this is the way that you could talk to an officer, have him, her, them transport a youth based on this. So again, it gets back to danger, right? That's really the issue here. You don't want danger to happen. In this case, mostly Juvenile Rule 6 is to themselves, whereas pink slip could be other people. And you can have a 12-year-old who looks a lot like a 20-year-old, right? It could be very dangerous if they act out. So don't take that lightly. These are very, very important. Again, part of the Ohio Revised Code as well here. Then where can you take them? So I've said it fast, but I'll do a little slower here. So generally, we're talking about a setting that the Ohio Department of Mental Health and Addiction Services is officially certified for this type of treatment or evaluation or examination. So any of the licensed psychiatric hospitals, they obviously don't go straight to the inpatient unit, but they could end up there. The public or state hospitals, they now call them regional psychiatric hospitals. If you ever see that written, that is the nicer term for state hospital. So they've had that for some years now. It also looks like before all pharmacists had doctorates, looks like their initials from way back when, I think. Anyway, so the general hospital. So let's say that the closest place is a general hospital that doesn't have a psych unit. Western Reserve, I think, would be an example of that here in Summit County. That's still okay. They can still go in there to get this examination. Obviously, it's another step if they then decide they need to be hospitalized to get them to that setting. And I'll come back to that one second. And then a community mental health provider, often called a pre-screening agency, which is an older term before Medicaid was elevated, not expanded, but elevated back in, let's see, July of 2012. But that's okay. We still kept them around. A lot of the counties kept them. A lot of board areas have kept them as we did, which is PEZ. So let me make a comment about that. Let's say that I pink slip Mr. Jones and I send him to PEZ, and I write on the top of the pink slip. Let me use that to show you. So I write on the top of the pink slip, psychiatric emergency services. Date and time matters, so I'm going to just highlight that for a second here. And then, of course, who I'm sending. Now, you notice, admitted, I'm actually looking for examined, so I hope we can change that. But the point is that I'm going to send them to PEZ. Well, if they need to be hospitalized, Pez doesn't have a hospital. So at that point, they're going to go to SUMA or Cleveland Clinic Akron General, sometimes outside of the county when there's no beds there either, potentially North Coast, but that unfortunately takes many days at this point. The state hospitals are all full pretty much every day across the state. So, but wherever they're going to go, guess what happens? You get, every once in a while, you'll get somebody who hasn't seen this education and says, oh, no, you need to rewrite a pink slip and put SUMA on it, or Cleveland Clinic Akron General, or Highland Springs, or Generations, or whatever, one of the hospitals. That is not accurate. So I just say that here. Most of them have heard the message now, but that is not accurate. You can definitively send somebody on a pink slip to an examination site. The examination is completed, and again, the back side of the sheet is filled out, and then the disposition is, hey, they call around, let's pretend it's SUMA. SUMA says, yes, we'll take Mr. Jones. The pink slip is done. And this is where people don't get it. So concretely, please understand that once a decision has been made, send home, hospitalize voluntarily or hospitalize involuntarily, the pink slip has done its job, and it's no longer in play. It does need to follow the patient to the next level of care for the medical record. So it would end up in the SUMA record or the Highland Springs record or what have you. That is important. Obviously, generally a copy is kept at the location where the examination is done. But please understand that. So the fact is the sheet does not need to say where the person's going. Having said that, first responders are reluctant to transport unless they have a pink slip in hand. So be aware of that. So what we've recommended, and the attorney also agreed on, is you could write Pez. You can put a slash next to it if you need to, if you're in that examination setting, and write the next hospital name next to that. You cannot change the date and time because you can only hold somebody for the examination for up to 24 hours. Now, normally it's hours and nowhere near 24 hours, but you could hold them for up to 24 hours. Now, let's say that Mr. Jones goes to Pez, as I use that as opposed to an ER. Well, it could be an ER, same issue. And they do examination within 6 hours, and the person is going to be admitted against his, her, their will to Cleveland Clinic Akron General, and it takes 20 hours. I'm using that on purpose. You now, in theory, have 26 hours, and somebody might say, oh, you're illegal, you're holding the person for this extra period of time, and that is not true. You have made a decision on the pink slip within the 24 hours, in my example, 6 hours. It does take time to get people to a hospital unit. That's not uncommon, usually within the 24 hours, but it can take longer. And that is not illegal because now you have said they need to be hospitalized. So it's illogical to say, oh, time's up, 24 hours, I'm discharging. So please don't do that. I'm just pointing that out here. We're almost done for time's sake. So, okay. So again, I've talked about who can fill it out. I've talked about it being a professional belief. Let me say the other thing, because it's a belief, nobody, this is quite a statement, I think, in any part of our country now, not a single person in Ohio has ever been sued for writing a pink slip. That is huge. What does that mean? That means that people understand we're not doing this willy-nilly. You're doing this when you genuinely believe the person needs help. They need the examination. And at that point, you're doing it in good faith. And again, the worst case scenario is you're getting them into a setting for up to 24 hours against their will, but the quid pro quo is strong here because you're getting them an examination, and if they need help, you're going to get them tied into help, even up to the point of hospitalization. Okay. The final thing I'll say here is it is illegal to write serial pink slips. So you can't write a pink slip, and let's say for some reason they don't get examined, and it gets to be 23.5 hours, you can't write another pink slip for another 24 hours. That is illegal, because now you've officially gone beyond the 24 hours, not because you're waiting for a hospital bed, but because you haven't even done the examination within that. That's pretty rare, but I just point that out. That happens if somebody is admitted, let's say it's a serious suicide attempt, they get admitted into SUMA, let's say on the intensive care unit, to treat the injuries from their serious suicide attempt. And now they need, but they want to keep them to go to the psych unit, which may take a day or 2 or 3. Historically, I don't know if Summa did it, but historically hospitals were in fact around the state rewriting a pink slip every 24 hours. That's illegal. There's other legal ways to get the court to say, yes, they're going to stay after it, but don't do it this way. Some hospital systems have created other color slips to solve this. So Summa has a yellow slip where the consult liaison psychiatrist, such as Dr. Ivan, excellent consult liaison psychiatrist at Summa, he can go and see Mr. Jones in the ICU and say, yeah, he's going to need to stay. And they do a yellow slip that says when he's done with the intensive care unit, he must stay and he will go over to the psych unit, for example. Perfectly legitimate internal process. So let me stop there. There's my contact information if you don't have it already, and I will take questions.